Sorry for the mess. Yes. Okay, today, first we will just have a brief introduction of our group, the economics working group. Then I will start off by just explaining about analyzing economic aspects in social services, what types of analysis can be used, and the opportunities and challenges with these. Then we will have some practical examples from Vive, where Rasmus will tell you about some of their reports, and Health Technology Wales, where Matthew will be telling you about their reports. They will come in the reverse order, so Matthew will be first out, just so you know. And then we're just summing it up with some concluding remarks. So, and just feel free to ask questions during the presentation. So the INSIA Economics Working Group, we are 8, 1, 2, 3, 4, 5, 6, 7 organizations represented, and we meet approximately 4 times a year, and we share our experiences and discuss challenges, and many of us has a background as health economists, so it's interesting to try to widen your perspective to not only think about healthcare, but now social services. Yeah, and we learn a lot, and there are very many different aspects to discuss as an economist in this area. So why do we need to analyze economic aspects? So we don't have endless amount of resources. We only have specific resources that we need to distribute on the things. There is usually the demand for services is often higher than what we can afford. So we need to prioritize what interventions should we pay for and what should we not. So the economic analysis is a method to systematically and in a structured way compare how much an intervention costs and what effects does this intervention generate. And within health economics, this has been established over a quite long time now, but within social services, we don't have the same experience. We will come into that later. But there are different types of analysis that you can apply. And today I'm going to tell you more about cost effectiveness analysis and cost utility analysis and cost benefit analysis. And I will come back to the other types later on. But cost benefit analysis, in a cost benefit analysis, both benefits and costs are expressed in monetary units. So when there are intangible effects or effects that are not market goods, we need to value these effects using methods like willingness to pay or willingness to accept to assess the monetary value of these kind of effects. And the result is quite appealing because it generates kind of a decision rule that if the benefits outweigh the costs, it's considered cost effective and something that we should invest in. So the result is expressed as a net benefit and expressed as a net present value because in general, we prefer things that happen today compared to things that are uncertain in the future. So future values are discounted and therefore expressed as a net present value. And if this value is positive, the intervention is considered cost effective. And I'm just to explain this in a better way, I'm going to use this example from a study that we have identified in a current project that I'm working on. It's not used as an example particularly because it's a very good study. It has big methodological challenges, but it's very transparent in how they present their methods. So therefore, I'm using it. So it's this article by Wimefall et al. From 2022. Costs and benefits of an early intervention for juvenile offenders, the Treatment Foster Care Oregon program. So it's set in a Swedish setting where treatment foster care is compared to treatment as usual. And we are not going to dig into the details here, what exact costs or effects that are measured, more just on a conceptual level to understand the cost-benefit analysis. So as you see here, can you see my mouse here? Yep. NPV is the net present value. And this part of the equation are all the benefits that are generated by this intervention. On this side, we have the costs that are generated by the intervention. And we can see this part are all the direct costs they have identified related to this particular treatment foster care. And they have taken into account costs to the legal system and to the healthcare system. And the next part are the indirect costs of a crime. And they have looked at the productivity loss due to violent crime. And then they also have this part where they calculate the intangible cost of a crime, and they have looked at the expected change in quality adjusted life years and have applied a willingness to pay of 500,000 Swedish kronor per QALY. And I will get back to what a QALY is, but maybe most of you are familiar with that, but quality adjusted life years. And then, so this is the considered benefit because they assume that with treatment foster care, the crime rate will decrease. So this will be the positive side of the equation. Then we have the cost side. So they take into account the cost of the program, treatment foster care, and they also take into account what it costs to provide treatment as usual. And the result is then, as I said, presented as a net present value. I'm not going to show you full, but the base case without any sensitivity analysis is that treatment foster care has a net present value of almost 40,000 USD. So this value is positive, therefore it is cost effective, is kind of the decision rule. But as you can see, when they vary the assumptions of treatment as usual, you can see that there are negative values here as well. And if it's negative, it's not considered cost effective. So that is like the conceptual idea of a cost benefit analysis. So we analyze whether the benefits outweigh the costs, and it's all expressed in monetary units. We use willingness to pay or willingness to accept to assess the value of effects. But in this part, like, how much are you willing to pay for these intangible effects? What are we willing to pay for increased social connections, for example, or reduced anxiety level, or increase in the quality of life? And all these values are embedded in the analysis and not maybe put out that explicitly in a cost-benefit analysis. And it could be quite complicated and ethical matters that requires more explicit, that it's put more explicit in the analysis. And so just to say, and cost-benefit analysis is also like the traditional analysis within economic analysis and what we try to apply in health economics at first as well. But because of these ethical challenges with valuing health and life, quality of life, cost effectiveness analysis and cost utility analysis has been developed within health economics. And now we're trying to adapted to social services as well. Um, so costs in a cost effectiveness analysis are still measured in monetary units or in monetary terms, but we let the outcomes be measured in naturally occurring units, for example, days in stable employment or number of substance use relapses avoided, or more generic measurements as quality of life, for example, and quality adjusted life years. The result of the analysis is presented as an incremental cost effectiveness ratio, an ICER, and that is the extra cost per unit of outcome obtained. So what we need to pay extra to obtain one more unit of outcome. So in the end, we need a value judgment to assess whether this ICER is considered cost effective or not. Is it worthwhile to pay this extra money to obtain one more unit? And yeah, so the cost effectiveness analysis can be structured like this. We have two interventions. We need to identify the costs and outcomes, and we compare the costs and the outcomes of the two interventions and the outcomes, and it generates this incremental cost effectiveness ratio, an ICER. And so in this case, what outcomes measures should be used? And a very nice thing about cost effectiveness analysis is that you can choose an outcome measurement that is very relevant to the area that is assessed. It could be avoided crimes, it could be anxiety level changes or social connections, but it's all when you use area specific outcome measurements, it can be very difficult to compare between different areas. And therefore, we prefer more generic preference-based outcome measures that allow for comparison between different areas. And the standard in health economics is to use quality adjusted life years, but usually those instruments that are used measure health-related quality of life, and that is a problem within social care since maybe other aspects are important as well, not only health-related quality of life. There are instruments that are developed more for social care, and that is ASCOT and IceCap. We do in Sweden, we have one research group also working on QALY, capability adjusted life years, which is different than to QALYs, for example. And I'm just going to show you what a cost effectiveness analysis using QALYs can look like. So this is a Swedish study as well, NEAT prevention through Sweden's youth payroll tax cut, evaluating cost effectiveness using QALY Sweden or SWE. So it's a cost effectiveness analysis of a payroll tax reduction in Sweden during the financial crisis, aimed at young people not in employment, education, or training. And what they saw was that the tax cut actually increased employment, and their analysis yielded this ICER that it costed around $55,000 per capability adjusted life year. And they also, when doing a cost effectiveness analysis, you can also get this cost effectiveness acceptability curve where you can see for different values per capability adjusted life year, you can also see here the probability of the intervention being cost effective. So at the value at almost 26,000 USD per capability adjusted life years, the probability of this intervention being cost effective is only 5%, so quite low. Whereas if the value of a capability adjusted life year is above 100,000 US dollars, it's almost 95% chance the intervention is cost effective. So it's different ways of presenting the result. Wait, I'm going to do like this. So just to summarize opportunities and challenges with CBA and CEA is that in a cost-benefit analysis, all consequences are expressed in monetary terms, which enables comparison across sectors. It doesn't matter what outcome measures that are relevant because all outcomes are expressed in monetary terms. And it's also easy to illustrate the return on investment. It is easy to say every euro invested in this intervention yields X euro return in benefits. And it's also easy to capture a broad range of benefits. It doesn't have to focus on one outcome measurement, but you can include all the different outcome measures since you value them in monetary units. But it can be difficult to monetize outcomes such as quality of life, both ethically sensitive and technically difficult. And the results depends heavily on these assumptions, which might be sometimes too embedded in the analysis to understand which assumptions that has been done. In a cost effectiveness analysis, we can avoid the ethical issues of monetizing outcomes. And we express the result as to gain an additional unit of effect, we need to pay X extra euros. And that could be very useful for prioritizing within a specific budget or sector, but it can be more difficult between sectors or budgets unless a generic outcome measure is used. It's also difficult to conduct a cost effectiveness analysis when there are multiple important effects that are not captured by a single generic measure. And ultimately, both approaches lead to the same underlying issue. How much are we willing to pay for a quality adjusted life year, capability adjusted life year, or for averting a crime, for example? And my personal opinion is that this may be less or more transparent in a cost effectiveness analysis than in a CBA, but a CBA, on the other hand, might be more easy to understand, just getting a number showing, okay, this is cost effective. We don't have to make this trade-off ourselves, but maybe that's also good that the decision makers has to decide how much are we actually willing to pay for an extra unit of outcome. So that was quick about cost benefit and cost effectiveness analysis. Cost utility analysis is when you use quality adjusted life years as the outcome measure, but it's practically the same thing as cost effectiveness analysis. We also have cost minimization analysis, and that is when we assume equal outcomes and just want to compare how much resources that are needed for the two different interventions. Budget impact analysis is to see how will this intervention affect our budget? Are we able to afford it at this moment, or how will our budget be affected by this intervention? And cost consequence analysis, that is when you can use multiple outcomes. You don't have to bundle them into the same metric or the same outcome measure. You can just explain how the intervention affects the different outcomes and the associated costs as well. So that's a different way of presenting results, but maybe also more difficult for decision makers since they have to they themselves have to weigh these different effects and costs against each other, or maybe more transparent in the end. So, quick crash course. And with that, I'm gonna leave over to Matthew. I hope you're here. I was a bit stressed, so I didn't get a chance to see if you were connected right now.
Well, I am here, so
You
that's good
are
news
here.
for you.
Great, Matthew. Thank you.
Thank you
Uh,
very much. Thank you. I guess just before jumping into the example itself, I'll just say maybe on our general approach, people are not familiar with HGW. As the name implies, we spend a lot of time looking at health technologies within the healthcare setting. So we're certainly very familiar with building cost effectiveness models and indeed particularly cost utility models. in that healthcare setting, but we also have social care within our remit, and we approach that in economic analyses too. And I'd say, picking up on the points that were just made, I think the challenge in social care really is in the healthcare setting, we're able to use those cost utility analyses where we measure effectiveness in terms of QALYs, and that enables us to check it against the threshold, which is usually used in Wales and indeed the rest of the UK, which is £20,000 per QALY. And if something's under that threshold, we can say it's cost effective. And I think the real challenge in social care is actually that there isn't an equivalent threshold. So that threshold applies only to healthcare settings because it's linked to the opportunity cost within healthcare. And so it doesn't translate into social care. So you could go down the road of actually estimating qualities in social care settings, but then you wouldn't have the equivalent threshold to apply it to compare it against. So it's kind of an inherent issue that we have within social care of not having a threshold like that. So instead, what we tend to do is be a bit more pragmatic in how we approach the economic analyses and just try to think about within each individual context what would be the most useful thing that we could do for the decision makers. Yeah, could you go to the
Yeah.
next slide? I'm hoping you have my slides up there because I have the same issues that you normally have with sharing slides on Zoom. So I'm glad I'm not the only one that struggles with that.
Perfect, Matthew.
So yeah, so the specific example I was going to run you through is a piece of guidance we did on something called Intensive Family Preservation Programs, IFPP. So these are short-term interventions aimed at families going through some kind of difficulty, some kind of crisis. So within Wales, as is probably the case through much of Europe, there are laws that sort of effectively say that children have a right to be happy, healthy, and all those things, that they're protected in those sense. But obviously there are instances where the family environment is not as ideal as it should be, and that a child's welfare could be at risk due to possibly to maltreatment or abuse or neglect in some form. So in such instances, social services have a responsibility to assess that risk and then intervene in a way that they think is necessary, often involving putting children into some kind of out of home care placement. So the aim of IFPP is a way of potentially giving that family an opportunity to resolve those issues, or at least minimize them, and put that uh, set up the home environment in such a way that the child doesn't need to be removed for their own safety, and in fact that they can stay within that family environment where hopefully their outcomes would be better. So that's the idea. So they work by being this really short-term, intensive period, aiming at improving the family skills and resilience, as well as sort of signposting them and making them aware of other support services that are already available. Um, and yeah, this was something that we considered for a piece of guidance for Wales. Could you go to the next slide, please? So in terms of how we approached this, so we did this with a cost consequence analysis. So one of the types of analyses that were just mentioned. So that enabled us to consider the costs and some of the outcomes that seemed to be relevant from the studies. In this instance, the all of the studies in this area primarily considered out of home placements as the kind of primary outcome in all the studies. So there was evidence suggesting that the risk of an out of home placement was reduced by roughly about 50% if you had an IFPP. So what we're able to do is build an analysis that utilized that as the key outcome. And I won't go through that model in full detail there. Hopefully it's clear enough. But run that through and look at the consequences of that. To apply some costs associated with those various outcomes that they might have, including the out of home placement. Um, and as well as that, there were some secondary outcomes from the study in terms of outcomes for the parents. So their psychological distress and reduction in substance misuse as well. Now, I should say, and it may have occurred to some of you that what we don't have in this instance is actually outcomes from the child's perspective as far as their kind of quality of life. If we're thinking of this in that kind of quality adjusted life year style view of looking at effectiveness, I think that's a real miss and something that we don't have that just wasn't there from the evidence. It's almost implicit that it's a good thing to avoid an out-of-home placement. That I guess that's the underlying logic of the studies that focused on that as the primary outcome measure. But I think it's fair to say that it's debatable whether that necessarily is the case, that that would be better given the environment that the children are in. You could argue that there would be instances where actually they'd be better off being in that placement. Or, at the very least, you probably want to quantify what the sort of improvements they might be having in their well-being and quality of life would be by avoiding those sort of placements. So that's a flaw, a limitation in the analysis that's effectively inherent in the actual evidence base on IFPPs in general. Can you go on to the next slide, please? Yeah, so with that in mind, this is what the results of the analysis showed. So as I say, you can see the out-of-home placements, you're running that through a model, and you can see that the number of out-of-home placements do cut roughly in half compared to what they would otherwise be. And you can see that for most of the things, I've kind of, in very basic fashion, I've kind of made them green if it's a good thing and red if it's not. So cost, but in the case of the out-of-home placements, I've kept them as black because I think that's a challenge of actually knowing it's not necessarily the case that that would be a good thing. I think it would be interpreted by most decision makers as a good thing. I think that's fair to say, but strictly speaking, we can't say that in an evidence-based way. Um, but as a result of that reduction, you do see a big reduction in the costs. So you do get big cost savings from this intervention. Um, and you also then see in terms of those secondary outcomes that you do get improvements in terms of parental substance misuse and psychological distress. It's a little bit confusing that third row. It's because it's actually a reduction. So in both cases, it's an improvement, but more of an improvement with IFPPs. Um, and we run this analysis as we often do. We run lots of alternative scenarios, through some deterministic sensitivity analyses, also some probabilistic sensitivity analyses. In this case, we found that the conclusions didn't really change in any of those alternative scenarios. So in all cases, costs were lower with IFPP and less care. So yeah, results in a lot of ways look quite strong for IFPP. So you go on to the final slide, please. So so what we do is we present all that analysis to our panel of decision makers, and then they determine the guidance. And as you can see in this instance, they felt quite strongly that the evidence does support the adoption of IFPPs for families in crisis. I've given you a brief summary of some of their considerations on it as well. You see there at the end, the final paragraph is talks about the economics specifically. They noted the uncertainty around it, and a lot of that is to do with the element that I mentioned around the out-of-home placements. But they also noted the big cost savings that were there as well. So I think overall, the committee kind of came to the view that, as it says in that first paragraph, that perspectives are that is probably beneficial based on some of the feedback that we'd had over the course of the appraisal. So obviously, it's not just a case of what we present in terms of the economic evidence or even the effectiveness evidence. We do also seek views of people directly involved. And overall, I think the views were that it probably is a good thing to avoid those sort of out-of-home placements. So whilst there was some uncertainty around that aspect, they were convinced, and also convinced, that there's no real evidence of harm anyway. So overall, I think it was useful analysis for actually informing the committee's decision making in this particular instance. And yeah, I think that's it from me, unless I've forgotten another slide.
No, that was the last one, Matthew, but thank you very much.
Perfect. Thank you very much.
We will move on to Rasmus.
Yes, thank you.
Yes, you're here. Let's see, sometimes I... Yes, just let me know when I should put the next.
Yes. you can just move on to the next slide. Yes, just very shortly about Vive. Most of you know Vive, so I won't do this extremely fast. We have offices in Copenhagen and Aarhus. We are called, in English, the Danish State Center for Social Science Research. And what we do is commission work from government departments and agencies, as well as for regions and municipalities. In addition, we have a lot of researchers employed as well who carry out a research project, usually in collaboration with researchers from universities and elsewhere. Um, yes, next slide, please. So what perspective is used in our economic analysis? Well, generally, we do mostly we handle mostly two perspectives, although sometimes, as I have written here, they are sometimes merged into one, cost analysis and impact analysis. In our definition, we sort of use a narrow definition of cost analysis in the sense that it's sort of more an intervention cost that we call the cost analysis. So that includes the cost of implementing the intervention, such as training, materials, and the big one, which is salary of those who are employed within the intervention. And the data for these types of cost analysis are usually collected from either survey-based calculations, from hours worked, or in the form of administrative data from those who have carried out the intervention in the beginning. So with the impact analysis, which I haven't written anything about here, is usually is what we see as sort of the impact of the intervention, which is mainly what happens after or during the intervention. And we, in that sense, we maybe have a broad definition in the sense that we use all types of different prospective outcomes such as labor market attachment, healthcare utilization, crime, and it could also be that, like Matthew showed us, um, substance abuse or similar. I don't have that in the examples that I'll show you now, but we have done other calculations from that. And so one could ask, why don't we do sort of a cost benefit analysis to the full and measure well-being and try to quantify and monetize well-being? Mainly, the answer for that question is that those who commissions the projects are not really interested in that. They are more interested in the monetary impact and the monetary the monetary impact on the budget. What are if a new municipality is going to undertake this intervention, will it have a positive or negative budget impact for them? And sometimes we also include other levels of government, but they are not really interested in us monetizing well-being, and therefore we haven't really done that. Although I totally agree that it's relevant. Next slide, please, to this. So the first example that I'm going to show you is an economic evaluation of an intervention called Reconnect, which is an integrated model that should reconnect youth with the symptoms of anxiety and depression to education or employment. So they are basically in the need group that Therese also showed in her example. And in addition to that, they also have symptoms of anxiety and depression. And it is the main sort of content of the intervention is that it's a supported employment model using the individual placement and support method. And I'm not going into more details about what the actual intervention contains, but rather say how we measured it. So the intervention has been implemented in 3 Danish municipalities over this period, and we evaluated the effect. We did the effect evaluation at the economic evaluation. So the economic evaluation has 2 parts. First, there is the intervention cost analysis, where we measure intervention costs over 18 months for the treatment group compared to those who receive service as usual. And then there is an effect evaluation, where we look at the non-subsidized jobs, income replacement transfer, and health utilization. And that will come on a later slide. Please, next slide to this. So to the Intervention costs, we collected, or rather the municipalities collected intervention costs on these from 69 from the Reconnect group and 48 from the Service as Usual group. And overall, the data quality was really good. If we as you can see from the top table, that we actually drew 70 um, randomly from the intervention group and 70 randomly from the service as usual group. But due to different issues, we already ended up with 69 and 48, which we would include in the analysis. Then the bottom table, you can see sort of the costs of Reconnect, which is, I should say, this is the average intervention cost per individual in euros over the 18-month period. So the average intervention cost for Reconnect was 5,700 euros, whereas for the service as usual, it was 8,000, almost 400 euros. That is, Reconnect was 2,650 euros cheaper than service as usual. And if we look at the components of the intervention cost, we can see that basically the main reason for this is that what is called other interventions is much cheaper for Reconnect than it is for the service as usual, and that's because that is basically things that municipalities or job centers have bought elsewhere at a quite high cost, which is not part of the Reconnect package. And obviously, the Reconnect intervention is more expensive in terms of these Reconnect services, but whereas the other two parts are more similar. Next, please. So also looking at the impact analysis, we used the data for all the screened individuals. That is not only the 69 and the 48. And then we looked at the outcomes in labor market, healthcare, and crime. And what we can see here is labor market total. That is the total of extra tax receipts and minus less outlays in income replacement transfer, and that is almost 3,000 euros per individual. However, if we look, and the others are much smaller, as you can see. As if we look at the 95 confidence interval, we can see that only the labor market actually is statistically significant. So the others are not significant. So basically, what we conclude from this analysis is that the Reconnect program is economically viable, mainly because it is cheaper than the service as usual, but also it has an element that seems to lead to a slight gain in terms of labor market attachment of the participants. Okay, next slide, please. The second example I will show you is an economic evaluation of what is called IBIS, which is a Danish acronym for that can be translated into, as it's written here, Integrated Healthcare and Vocational Rehabilitation for Sick Leave Benefits Recipients with Common Mental Disorders. Again, the main sort of structure of the analysis is very much similar to the one I just showed you. That is, we have data of the interventions, intervention costs, which consists of what the job centers gave these sick leave benefits recipients, and in the intervention also was treatment that they got at in and outpatient visits at psychiatric ward at a hospital. So these two parts both contained the intervention costs, and then there was we looked at the impact in other areas. Next slide, please. As you can see here, we measured in the outcome in all these areas. These here are non-monetized values, I should say. As you can see, the units are hours, sessions, weeks, etc. Again, we have the service as usual column and the IBIS column, and you can see, for instance, that if we take like row number 2, the job consultant, the EBIS participants had 11.95 consultant sessions on average, and the others have just 9.2. And what we did is we estimated all these potential outcomes, and then we multiplied them with unit costs to get a monetized value for the outcomes. And you can see that on the next slide. Here we have made two different economic analysis, both of the government budget impact, which corresponds to the one that I show you for the reconnect analysis, namely just what is the impact for various government levels. And we can see here that I should say that a minus here shows that the EBIS intervention is more expensive or less leads to less saving than the service as usual. So actually, over 24 months, the EBIS intervention costs about 3,000 euros more per individual than the usual service, if we look at government budget impact. And if we look at the total economic impact to society, the amount is closer to 5,000 euros per individual. And why is that? Mainly because those who the EBIS program tried to help, namely those who were on extended sick leave, actually had a worse labor market performance when they were in the EBIS program than when they were out of the EBIS program. So in that sense, the EBIS program tend to keep them longer on sick benefit and sick leave rather than re-entering the labor market. And also you can see the other areas. There are obviously some, but much smaller impacts in these areas. So the main contributor here is the labor market attachment. Okay, I don't know if we have time for one final example or if we should skip to questions or discussion.
Yes, good question, Rasmus. I think if you can get three more minutes.
Okay, this is an example as I also presented. So some of you have already seen this from in Paris. This when we at the INSIA meeting. We at the Vive developed in 2016 to 18 a Danish calculation model for budget impact, also called the social economic investment model. It's an Excel-based calculation tool, which has today 103 predefined target group within these 4 areas that are shown below, and the number in brackets are the number of target groups within each area. And I should say that the model version that we developed back in 2018 target groups, and since then the model has been gradually growing up to the current size. And all these target groups are defined using individual level data from Danish registers. That is, for instance, say people who live in homelessness, they have been defined by looking in the registers and seeing which people have lived at shelters paid by the municipality. And these, you can only get to live in a shelter paid by the municipality if you register with your personal identification number. And therefore we know exactly which people it is, and therefore we can use this information to define them as homeless in a given period. And similar can be used for the other target groups. Yes, we can change now, please. So the economic consequences of social interventions are estimated in a number of different areas: income, employment, healthcare, social interventions, primary and secondary education, police and corrections. And what the model is, since it is an Excel tool, it can provide figures such as the ones to the right, where you can see the development over time for each target group, and When you use the model, you also have to enter an expected effect size for the intervention. So that obviously the economic impact of an intervention depends crucially on the effect size it has. Okay, next slide. I think that's the last one. So what is not in the model is content-specific things. So what is it? For example, literature searches. It doesn't have long-term projections. Some social areas, such as, for instance, childcare services, have possible long-term impact. So that's not in the model. And obviously, the predefined target group, although there are many of them, and one should think that maybe you can always find one that fits, that's not really the case because municipalities are different and settings are different. So that's an ongoing challenge with the use of this type of model that everything is predefined. But I think still it remains a good tool for assessing the economic impact of successful social interventions. That was it from me. Thank you.
Yeah, thank you, Rasmus. Just thinking that maybe we should try